and are ready for our final session of the day. We'll be discussing student health and well-being, and I'm really happy to introduce our esteemed panelists for this session. Barbara Newth from Cornell University, Dana Williams from Howard University, and Jim Grover from the University of Texas at Arlington. Like the other sessions, I'm going to provide a little bit of a high-level overview into some of our survey findings, and then we'll ask the panelists to have a broad discussion of student health and well-being on their campuses. So just to provide a little bit of context on where the responding institutions place student well-being issues as a challenge for this academic year, the 2020-2021 academic year. We asked respondents what they believe to be the top 3 challenges that they were going to face this year. As you can see from this slide, assisting international students was by far the most frequently endorsed item, with 73% of responding deans indicating that that would be a top 3 challenge for them. But following that was student well-being issues, with just under 50%, 48% of responding deans indicated that that was going to be a top 3 challenge for them. We heard in the first session that this is not a surprise finding, probably for most of you, that this really has been a big concern as a result of COVID for our deans. So then we were interested in doing a little bit of a deeper dive into what those well-being issues were. Things like access to housing, food insecurity, physical health concerns, things of that nature. And here we can see, I want to highlight a few specific findings on this. First of all, for our responding deans, at least 50% were saying that each of these were having a large to moderate impact on their graduate students. So while access to housing was comparatively having not as grave as an impact as some of these other items, still 50% of the responding deans were saying that the graduate students have been largely to moderately impacted by access to housing. Another finding that I want to highlight is that loneliness and other mental health concerns really outweighed physical health concerns, even in light of COVID and some of the physical challenges that obviously brings for the graduate students. And then finally, loneliness was the most frequently endorsed item for having a large or moderate impact on the graduate students. We heard a little bit of that in session 1. We'll hear certainly more of that as we go through our panel today. But one of the items that Jerry from Rutgers brought up in session 1 was how they were having clusters and trying to address some of the loneliness issues through outreach within the clusters. We've seen through some of our innovation and best practice and promising practices responses to some of the survey items that there are some institutional and graduate program initiatives that are really trying to combat this loneliness that a lot of the graduate students are feeling, but also some grassroots efforts, if you will, with the graduate students starting some of their own initiatives. So in addition to broadly understanding how the students were being impacted, we were also interested in really understanding if there are differential impacts by student groups. And we saw that there really were, particularly with international graduate students and graduate students with families. Karen mentioned a little bit about this again in session 1. We saw that the ability to travel for international graduate students is certainly placing great additional stressors on the student group, both the ability to re-enter the US as well as the ability to return home. Nearly 100% of responding deans were saying that these are large to moderate impacts on their international graduate students. One graduate dean even provided a little bit more information and said that he felt that their international graduate students were feeling almost that they were unwelcome or undervalued by the United States as a result of some of these travel restrictions. Similarly, graduate students with families have added stressors with childcare and homeschooling. Nearly 90% of responding deans have reported that these are offering large or moderate impacts on them. I'm sure that there's a few of you, at least in the audience, who can attest to that and really struggling with how you maintain your own work and your own progress in light of some of the childcare needs that are a result of school closings and whatnot with COVID. And then the other thing that I wanted to point out on this slide was finances. And just under 50% of responding deans were saying that finances were really having a large impact on both graduate students with families as well as international graduate students. Again, in session one, we heard that significant delays were impacting students. We'll hear more tomorrow about budget cuts at the program and institution level, and that these students are really feeling the stressors of that. So with these significant stressors, we were interested in what student resources were. We see that all but 2 institutions reported that they provided mental health services to graduate students prior to COVID-19. Almost all of them continued these services to all students in need, with a handful continuing these services to students in crisis only. We're also seeing an increased use of telehealth, and we'll hear more about this tomorrow as well. But because we're focusing a little bit on challenges today, not all innovations come without their challenges. And so we had 2, I thought, pretty insightful quotes from our respondents that got to some of these challenges around the increased use of telehealth. The first one is, I think moving to the virtual mode resulted in many changes. I'm unsure how and if they'll remain. I've heard that counselors find Zoom incredibly exhausting, and burnout is a significant issue. Again, I think many of us can attest to Zoom fatigue. And so understanding that telehealth right now is working, right now is a useful initiative. How that will be used moving forward remains to be seen a little bit. And then another respondent commented that in some cases, telecounseling has been very effective and has allowed some increased mental health access. However, state law does not allow students outside the state to receive counseling from counselors in the state. So again, maybe some access issues with the use of telehealth. So with that background from our findings, I'm pleased to introduce our panelists, reintroduce our panelists. We'll be starting with Barb Newth from Cornell University.
Thank you very much, and thanks for that background. So let me provide a bit of context about Cornell University and then some comments about student health and well-being. Just to set the context, Cornell is located in central New York. It's not an urban environment, perhaps in part related to this. Our COVID case rate has been very low. We have a very extensive surveillance testing program with the capacity to run about 50,000 tests a week. Our students are tested once or twice a week, faculty and staff tested weekly or biweekly. So currently there's a fair amount of confidence that we're doing okay related to COVID, but up until this point, really the start of the semester before surveillance testing really got fully underway, there was quite a lot of anxiety among graduate students, particularly research degree students, about exposures related to their interactions with undergraduates. And, you know, put on top of that, all of the other concerns that we've been hearing about from the prior speakers about academic progress, about careers to go on to once they graduate, all of those sorts of things. So certainly student health and well-being has been top of our mind given the challenges of COVID. A little bit of context as well that I think it's important for all of our institutions to think about is that we're seeing that the student health and well-being issues and challenges that from COVID that students are facing are really quite different in some ways, similar in some ways, but quite different in some ways depending on what the student population is. So for example, contrast what students who are new in the fall of 20 are experiencing versus continuing students who already know people, who have connections, who had their housing lined up. Contrast how professional degree students who are mostly course-based and had to adapt fairly to technological limitations and online learning, how their experience and challenges are different from research degree students whose academic progress may evidently be slowed because of lack of access to research facilities and so on. Even within research degree students, I think it's important, and the earliest panel touched on this a little bit related to funding and time extensions, but for research degree students, we're finding that the challenges and thus the well-being issues are different from early stage research degrees students who are more course-based versus late stage research degree students who may be writing and analysis-based, and they can do that from home to some degree, versus mid-stage research students who may be facing the most challenges because their research is actually being disrupted. I'll also call out that there are differences in the degree to which university administration understands even research degree students. There's a lot more understanding directly of the concerns for lab-based programs than, for example, library-based programs. We even had our deputy provost who was proudly quoted in one of our university communications as saying, someone working in the humanities with books probably hasn't been deeply affected by the pandemic. You know, somebody who hasn't had access to libraries for several months now, somebody who's working with books, who is at home with elementary age children that they have to mentor and teach, I would beg to differ with that comment. Also, we can then look at graduate students from various minoritized communities, and here I'm using minoritized in a broad sense. So graduate students who are single parents, that's a minority group, but you know, they're an important group. Students who are themselves immunocompromised or have COVID vulnerable household members. Graduate students from identity groups that are statistically more at risk to COVID effects, including Black students or students from Latinx communities or low-income students. So all of these, you know, have their very specific concerns about student health and well-being. So how we're approaching this in terms of strategies for responding is to recognize both that Cornell and everybody else is in the situation of a global pandemic and national crisis of issues of social justice and particularly racial injustice. We recognize in faculty workshops and student workshops, again, now that are all being held remotely, that we're being challenged by this, you know, increased worries about uncertainty about the future, health and safety and security, not only of ourselves, but of our family members, our household members, family members who we may not be able to see in person for quite some time. Financial concerns were touched on earlier, racism, discrimination concerns, as well as all the academic concerns related to productivity, motivation, next steps with employment, even you know, the very real concerns of students now wanting to align their academic responsibilities with social justice responses and wanting to feel that their own research and scholarship has some impact on social justice issues. So how we are refocusing our well-being strategies, and particularly working with faculty to refocus their mentoring strategies, is with a few messages that we're sharing with faculty. One is to keep lines of communication open with students and really explicitly schedule time for communicating with students. Whether it's in person for those who can meet that way, social distanced with masks, or whether it's through remote means like Zoom. Consistently and periodically reviewing expectations and providing feedback, helping students really think about and make decisions about how to pivot their research, how to pivot their scholarship in response to the challenges that they're feeling. Supporting a sense of belonging, you know, actually scheduling meetings and scheduling community events that may be remote. Helping students find meaning and purpose in what they're doing. And again, this may be pivoting their research to be something that's more responsive to COVID challenges. Importantly, having faculty endorse with their students stress management and self-care practices, and encouraging help-seeking behavior when it's needed, you know, to seek out mental health counseling, telehealth counseling. And finally, I'll close, and I can elaborate in discussion on any of those elements of what we're focusing on, but I want to leave one final strategy, and that's that we're really communicating and sending a message to faculty to first take care of yourself as faculty who are also facing all of these challenges, childcare, household members, financial, in some cases, all of these that we're talking about. Take care of yourself in the sense that for faculty, you can't give to your students what you don't have yourself. And so if you're not feeling a sense of resilience, motivation, well-being, some level of comfort with degrees of certainty about the future, you're not going to be well positioned to give those messages to your students and to support your students. So faculty need to take care of themselves as part of helping support their own students' health and well-being. So I'll pause there and turn this back to Annie, and then I look forward to the discussion.
Thank you, Barb. That was great. Faculty need to put on their own masks before helping others, I think is one of the takeaways. A lot of good stuff there. There's no one size fits all. A lot of our students are struggling. They're struggling with different things. Mentoring is certainly a thing that was raised in the survey, and I think a lot of opportunities for follow-up there. I really appreciate your comments. So next we'll hear from Dana Williams from Howard University. Dana?
Playfully, one of the graduate students who has since graduated and works somewhere else, like still calls me Dana English because I was chair of English. Like for the longest period of time, she kept saying Dana English or Dr. English. And I thought, okay, I chair a department of English, so I'll just answer. So now that she knows that I'm Williams, she still calls me Dr. English. So I'll answer to Dana Howard. Thank you so much for the invitation. And I want to echo a couple of things that Barbara said, and then put some context around it that would be specific to Howard. So we are a 10,000 student campus, probably a little bit higher than that because actually at the undergraduate level, our enrollment did increase. We stayed steady at the graduate level. We're an R2 comprehensive university and also an HBCU. And that context becomes important because we have these degree programs that are lab-based, that are research-based. We have professional school students, the law school, the med school, the dental school, nursing, and the School of Business. And some of those students are also in PhD or master's programs. So we do see some integration, but by and large, there are 33 degree programs that are exclusive to the graduate school at Howard. Overwhelmingly, our population is Black and Brown. So you can only imagine the disproportionate impact on our student population, either directly or indirectly. We also have a significant population of international students from Africa and diasporic African countries, and some Middle Eastern countries as well. But again, most of whom identify still as Brown. We closed after spring break like most campuses, and then we reopened for the fall, but we do not have students on campus except for in the professional medical sciences. And that makes some difference in terms of the context, particularly as Barb mentioned, for the new students who are not on campus and their understanding of health and well-being off campus and on, I mean, it's different from the students, or their interpretation is different from the students who had been on campus and understand and can build community in different ways. One quick kind of anecdotal example is one student who reached out to me directly was inquiring about like whether or not she could do it. So she had a strong undergraduate background, a master's degree from a top program, and was in a PhD program. But because she wasn't actually able to sit in the room with other people before class started or to walk out after class was over, she really did think that she was the only person who was overwhelmed and unable to keep up with the reading. So that literal kind of physical presence, the difference between logging on to Zoom quickly just before class and exiting as soon as the meeting is over, is something that we've also tried to help the students understand, that if you can hang around just a little bit longer, the way that you would linger after class, even as that screen time is really difficult, that will help you with some acclimation. And then of course, you know, our students are really big, as students on most campuses are, with GroupMe. So they're building community on text, but we also want them to build community with voice and with vision as well. We have testing available on campus for about 5% of our students who were housing insecure are actually on campus, and these are graduate students. And we typically have graduate student housing that's separate from the undergraduates. And we did see some students who felt very strongly that they needed to be on campus, if for no other reason than they didn't have sufficient study space, which is something that we saw in the study as well. I'll talk a little bit about some obstacles, some actions that we took, and then some innovations, and finally wrap through by talking about some things that were unique to Howard. The obstacles are pretty straightforward, some of which you have already mentioned and heard about, so I won't go through those. I'll just try to look at those that we haven't talked about just yet. In terms of well-being, the students are still struggling with what they're calling work-life balance, which of course, as Barb suggested, faculty have not managed to establish just yet, but we're trying to give them strategies really to make those separations, even when the physical space isn't possible for them to leave one room to go to another room, to understand that I'm now done with work and I'm coming back. They're also trying to balance their responsibilities as TAs, which is really important. So they are wanting to be extended the same kind of grace that they say that they're extending to their students by saying, oh, it's fine, we're in a pandemic, if you don't turn everything in immediately, it's fine, but they aren't seeing the same kind of grace being extended to them by their faculty. In some instances, I'd say 90% of them feel that, you know, the faculty are fully prepared for the online instruction, and also have not tried to put 16 weeks of work into 14 weeks because we did also shrink our semester. In terms of other things that we saw challenges in terms of their well-being, many of our students are insured exclusively through our student insurance program, and we have a hospital on campus, so that was 100% of their medical relief. So their primary care physicians were there, particularly their mental health providers were on campus. Some of them who needed prescriptions were unable to get their prescriptions because they couldn't write the telemed prescription. So that was something that we had to figure out how to mitigate. And then we also had to make sure that the students who were insured, that we extended our practice or the premiums for those students so that students who were not local could also have their insurance accepted wherever they were, because many of them decided not to come back to campus. The library access was a real issue just in terms of their stress levels, because they weren't being, the responsiveness wasn't what they hoped it would be. And that's the case with a number of things what we talked about with them with stress, the lack of responsiveness. Somehow it was expected that people would be more responsive instead of like understanding that there are more things going on, more people to access, more touch points. So really trying to get them to understand, like not just patience, but also not to cringe every time they saw an out of the office message or a message that was an automated response. I think the other thing that would stand out would be really thinking about faculty, not just preparation, but integration of multiple outcomes into a single assignment, for instance. So how can we do everything that we want to do? Because they are all clear that they wanted to meet the academic excellence mark. But in terms of an innovation, one of the students suggested, for instance, like, can we figure out how to meet multiple competencies with one assignment instead of just insisting that we're doing multiple assignments, particularly when it's in the same discipline? So one of the things that we worked with graduate faculty over the summer on was, if you know that you have all first-year students or all returning students, we had those faculty meet in cohorts to make determinations about what are you going to cover that I don't have to cover, so that we aren't compromising content. And that was something that came out of discussions with students at the end of the semester when they were discussing things that they thought could have been done better or differently when we had to really collapse that semester after spring break. So that also takes me into the actions section of my introductory comments. So that was one of the things that we did to try to get faculty in disciplinary cohorts to work together to mitigate some of the overlap of work and duplication when possible. We also worked really hard at community building, everything from coffee hour to happy hour to hump day Wednesdays to, we have already a thing that we called Healing at Howard that we extended to the graduate students because it was foremost an undergraduate program. We gave students who we thought were seeing some undue financial burden from the insurance premium fees that are automatically charged. Students could decline that, which was complicated because we also still had to have a certain number to meet our premium. Otherwise, we had to pay out of pocket. So the default for the undergrad was you can opt in, whereas for the graduate students, you had to, submit a waiver to opt out. But the students who actually had it through their partner or through employment could opt out, and that was some financial relief as well. And then we increased the number of therapists who were available, but I think it's really important, and I can't emphasize this enough, particularly with so many of our faculty in clinical psychology who are clear about this, and our social work students who in some instances were working with students as well. The therapists themselves, even though we increased the number, were also exhausted, and we're also trying to manage Zoom fatigue. And I think a couple of things for the innovations, the students were also very clear this semester in particular, coming into this experience, that they wanted to be a part of something that created a model so that we can imagine a different world, because no one wanted to go back to, well, let's just go back to the, kind of pre-COVID world. So we've seen students say that they're more committed than they ever were to being change agents and to using their disciplines to do some of that work. So we're trying to figure out ways that we can help them create these models and to think about what that would look like. And finally, the thing that I'll say in terms of something that's unique to Howard that's also relevant to the survey, which was disheartening to me in so many ways, but we're also still trying to figure out how we can work through that, is the same kind of challenges that you saw in the study with international students in terms of feeling unwanted and undervalued. Was the case for not just our international students, but our African-American and Latinx students. And of course, that's a big part of our student population, a significant part. But their feeling of being foreigners in a country that was their country of birth because of the racial unrest over the summer that created this kind of twin pandemic. So they also understood that this COVID was impacting them disproportionately, but the racial violence created an additional layer of uncertainty. So interestingly enough, they talked more about that than about COVID. They felt like we can manage COVID. We may not survive like the racial violence in this country. So that in uncertainty and distrust in government, they wanted more certainty and more trust and more communication from us as people that they saw as allies and people that were interested in the same things that they were interested in. And a similar kind of challenge related to students with families, with those additional responses, or childcare, quiet space, anxiety about finances. All of those things were disproportionately relevant to our students because they were members of those groups that were disproportionately impacted by COVID or by these circumstances, even preliminarily. So I'll stop there and take any questions that are related to some of the things that I mentioned in passing, and then pick up on some other themes as time permits.
I don't know that I've heard the term twin pandemic before, but I think that that's a very descriptive and visual way kind of thinking about what's happening right now. And certainly we're already getting some questions in around social justice and racial justice. So we'll have some time to address some of that once we get into more of our discussion. Thank you for those comments.
Of course, thank you.
So now we have Jim from University of Texas at Arlington.
I'll start by saying a little bit about our university. It is an urban serving university. It's an R1 and an HSI in the Dallas-Fort Worth area in the state of Texas. And as a public institution, we've been more or less under a standing mandate to remain open in some sense. And we've had some latitude over what being open means. So over the course of the past months, we have had a lot of our didactic courses being taught online, but our research facilities have mostly remained open and available to graduate students and other researchers. We've had some guidelines in place that for social distancing, masks, etc. Certain kinds of human subjects research, as well as research relying on travel, have not been able to go forward. But we've been more open, I think, than many other universities around the country. During that same time period, there's really been very low incidence of disease and disease transmission on campus. the relatively small number of cases we've had, contact tracing is showing, have come primarily from social and family gatherings, not from activities taking place on campus. In terms of information about the health and wellness of our graduate students, some information sources that we have include various focus groups and surveys that an AGEP grant group undertook, that Masters of Social Work interns undertook in lieu of doing things in their usual internships and practicums. And we also had some faculty senate task force that looked at things. And these sources of information are focused to some extent on students from underrepresented groups, to some extent on students who are parents, and to some extent on the faculty-student mentoring relationships. The way these surveys and focus groups were done, they're more likely to surface problems than they are to highlight solutions and things that worked. And they're also somewhat biased towards doctoral students, full-time graduate students, and those employed as graduate assistants rather than other categories. So they're neither quantitative nor representative, but they're still interesting. One of the things that surfaced in these investigations is that there's been a wide variation on our campus in the management approaches that have been taken towards graduate students and indeed towards others concerning how people should be employed in their work. How much leniency, flexibility, and accommodation or not has varied widely. And also kind of connected to that, we've learned that our leave options for graduate student employees are poorly defined in policy and in practice. And in many cases, or some cases at least, graduate student employees have not been offered good options for leave or other accommodations by their supervisors. There's been a lot of lack of clarity in how to apply the policies that we do have. And many students have felt that they fell between the cracks that exist between student and employee status. Some of the student employees report their supervisors asking inappropriate questions about their personal health status or family status when they've requested leaves or accommodations. And we've realized, and we're putting together a group to look at some of those matters regarding student confidentiality and student leave and so on. Some of the other things that have surfaced and what we've been looking at echo many of the things that Craig and others talked about earlier in today's session in terms of the anxiety that many students have felt, low motivation, depression, etc. Especially among our international students, as you might expect, there's been a lot of anxiety around their residency status, around their families back home, around all of the things that we've heard about. And something which has probably exacerbated that, at least for some individuals, is that the frequency and quality of contact by their faculty advisors has been highly variable. Some of our graduate students have essentially felt that they've been abandoned by their advisors, while others have reported that they've had frequent and helpful interactions. And our faculty senate has a graduate student mentoring task force that has already formulated and begun to publicize some best practices in online mentoring, which is how a lot of the mentoring is now taking place. We had one of the tasks that our social work interns were particularly taking on was looking at those students who are parents and some of the work, life, and family responsibility challenges that they've had. Those students who have children have reported difficulty in managing their student and working lives. There are some students who've had similar problems with elder care responsibilities. And in particular, again, highlighting variation in how our faculty and other supervisors of graduate student employees have behaved. There are some supervisors, and particularly among our faculty, whose children are out of the house and who don't understand, I think, that their graduate students are at a different stage in life where they have young children at home, responsibilities for homeschooling and for care that they did not expect to have, and they're not on call 24/7 to do the things that supervisors are asking them to do. Related to that, there's been heavy reliance by some of our faculty on their graduate student assistants to help sort out the technical problems they've had with pivoting to online learning in their courses. And again, having unreasonable expectations for how much help they can get. Now, on the other hand, in many cases, our graduate assistants have been better prepared and better able to deal with some of the technical features of online teaching and learning. And in some cases, in the best cases, that can be somewhat empowering, but in other cases, it's led to this difficulty with their faculty supervisor being over-reliant on them for help. One of the things that we've done with our social work interns is they haven't just been surveying our students about their difficulties as parents and with other family responsibilities. They've also been referring people out to community resources to get assistance with some of that where they can. Finally, I'd like to say a little bit about some of the disparities relating to race and gender that might exist. It's a little bit hard to get a handle on that. Certainly, pretty much all of the pre-existing disparities that were there before the pandemic have been amplified by what's happened, particularly gender roles in childcare. Nearly all of the student parents that were on the radar of our surveys and focus groups were female. We've also seen that, similarly to what has happened at Howard University, that the international students and the students of color have very similar concerns and anxieties about the job market, about their place and how welcoming the society is to them. There are really some striking similarities in some of the comments that have surfaced. Certainly what we've seen points to a need for some stronger community building among our underrepresented graduate students. We'd started to do some of that before the pandemic through the auspices of an AGEP grant and some other initiatives, but this is certainly something we'll need a more coordinated effort to deal with as we go forward. So I will stop there. I know that there must be many questions and we need the opportunity to look at those.
Thank you, Jim. The questions are rolling in, but I really appreciated what you said, about the assistantships and some of these added pressures that our graduate students are facing. It was brought up in the last session that, first and foremost, we maybe need to look at these graduate students as students, but we're really recognizing that they're not just students most of the time, that they're also workers and have a lot of other responsibilities to the institution and to their program. This was something that was not well covered in the survey, and frankly, it just wasn't on our radar to the extent that it is now when the survey was being developed. And so I think that this is a really wonderful opportunity to address this because we don't have a lot of data on it to discuss. Your institutions are very varied, and I'm interested in what you're doing to support racialized minorities in your graduate programs, particularly in the environment in which we're living. And I'll throw it open to whoever wants to start.
Jim, were you about to start? Go ahead. I'm a teacher, like at heart, right? So I saw that raise your hand feature.
Yeah, okay, I will try to be quick so you get your chance. The honest answer is we're not doing enough. We have an AGEP grant that had begun to do some community building among our graduate students of color. They did some very good work. An interesting point is they did their focus groups in May prior to the murder of George Floyd. So that dynamic had not perhaps begun to affect the responses we got, and yet we got very similar responses or expressions among our students of color about what is their place, what is their motivation for what they're doing, what is the job market going to look like, what will they suffer from the world at large, very similar to our international students, even prior to the George Floyd episode. Now, we have, like many universities, rolled out a whole lot of responses and ideas after that took place around June. We had some initiatives underway in the graduate school to provide some fellowships that are targeted specifically. In the state of Texas, we cannot target them on populations that are historically underrepresented, but we can target some support and fellowships and things like that on students who are interested in those problems. And so we had begun an approach of trying to support that specifically in hopes that it would not only help some of the students that we want to help, but also produce some insights that really would be of benefit. So I'll stop there and let Dana have a say.
Well, what I was going to add is that we have the good fortune at Howard of having, been invested in this work all along. So to some degree, what we have been thinking about is how do we model it? And as you're talking about an AGAP grant, like one of the things that we're actually doing and that we just got funded for, and thank goodness we got funded for it before like this latest executive order that suggests that you can't really deal with diversity in, federally funded initiatives. But how do we begin to share with others that model? That's one part. I think that we are all being a lot more active. So part of what I'll say is like, to some degree, we have been an insular campus. And by that, I mean, we have enough challenges that we tend to say, we'll deal with what we have to deal with internally and not be so invested in participating in other groups of people who are thinking about this like from a peripheral point of view. But that shifted aggressively, I can tell you, with the graduate faculty, for instance, because what we're also saying is now part of the responsibility that other schools will have to take and are willing to take differently would be to think about hiring our students in a way that they wouldn't necessarily otherwise, think about what postdocs look like for our students, think about the work that we're doing, citing our scholars, investing in the work that our scholars do, and so on. So we're really looking to say, we're this resource that's available. How can we avail ourselves to you? Even as, again, part of what we were saying before was, listen, we do this work and it's exhausting in and of itself. We can't really do that work for you too. But the reality is we don't have the option. We can't opt out anymore. Because if there are going to be changes that are systemic and long-term, where we're not having this conversation 20 years from now, 30 years from now, even 5 years from now, then we are all going to have to be a whole lot more aggressive and say, if you aren't willing to go into your departments to have those really tough conversations about why only hiring people from a top 10 school is not a good idea, then we don't have anything to say to you. Now we can give you some pointers about how to have that conversation and have you understand that our students are doing both the traditional like disciplinary training and the racial injustice and inequality and financial inequality and queer and gender studies inequality. We can convince you that we're doing all of it, which is really difficult for our students, but you also have to be willing to go in and have those conversations with your peers and with colleagues to say, we have to shift.
Yeah, this is Barb from Cornell. Just to add something that I don't think has been mentioned. Cornell, we've continued with and pivoted some of our faculty and staff and student support programs about inclusion and diversity and anti-bias and unconscious bias, and certainly we need to be doing more of that. Specific to COVID though, one of the additional things that we're just trying to really raise awareness with faculty who advise graduate students is to recognize that as I mentioned earlier, that have faculty recognize that there are certain communities that are much more deeply, much more seriously affected by COVID, and particularly Black communities and Latinx communities. And where we really focus on that is really that, helping faculty understand real examples where these students from these communities are much more affected by COVID-related illnesses and COVID-related deaths. That literally when we talk with our white faculty and our white students, very few actually know personally somebody who has died because of COVID. When we have those conversations with Black students and with students from Latinx communities, they personally know not just one, but several, if not many, people who have died because of COVID-related illness. And you know, when you put it in really stark terms like that, that brings in more of a sensitivity and awareness to bring crisis management skills, and you know, as Craig referred to earlier, you know, based on growing out of the NSF Rapid group work, you know, that notion of trauma-informed work, trauma-informed understanding, and really working actively with students to help them feel empowered, to have some control over what they're doing academically and what they're doing with their personal life, and that, you know, academic work-life balance, through having their faculty understand more deeply some of the very personal concerns that they're going through.
If I could just add something really quickly, Anne, to one of the things that we were invested in that was actually something that came out of the graduate school, and we had graduate students working on it, even in a way that, like, we didn't typically have the budget for it, but there was this separate COVID budget that we made available to this polling, was around the very issue that, you know, we're talking about. So when we asked, if you look at polls now, you see out of 1,500, a small population will be Black and Latinx. So the work that we're committed to doing and that we want other people to be committed to doing similarly is, what does it look like to design a survey that asks specific kinds of questions that are culturally competent, but then also to ask 100% of Black and Brown communities these questions, so that it's not like a slice of the population. And what we saw out of that survey that this polling group did, for instance, was that it wasn't just the pre-existing conditions. It wasn't just the, you know, kind of compromised healthcare, if you will. It had everything to do also with Black and Brown people being essential workers and not having the luxury of not being available and to say, I can't go to work. And then along with that, of course, not having the option to socially distance in the same kinds of ways. And we were able to see that, like, early on, before this became like really public knowledge. And it's an unfortunate thing to know something but still not be able to do something about it. So we also want to help the students to see that there are research avenues and methodology avenues that you have to pursue, but then we also have to move it to the point where, all right, now how can we fix this? Or how do we, you know, make these adjustments as well?
That's really great, Dana. I would be interested in hearing a little bit more about that study, or if there's any literature that you can pass on. I think that's welcome and needed right now. Thank you for raising that. Do you know the name of this? That would be great. Yeah, thank you very much. So I want to pivot a little bit to a slightly different topic. We've been, you know, really obviously focusing on health and well-being, and a question that came from an audience member that addresses health and well-being in a slightly different way. And I'll just read the question. We've seen a huge benefit of moving to remote qualifying exams, dissertation defenses, and thesis research advisory meetings. These are easier to schedule. This positively impacts well-being. What new practices will we carry forward into the hopefully non-pandemic future? And how can Zoom and other technologies help make things easier for the graduate students? So this is really kind of taking the understanding of this technology, which we're all being forced to use a little bit. And I think we're all really understanding that there are easy ways to use this, and it's bringing folks together in a different way, and maybe bringing more folks together than when we're constrained by physical location. But there's also, as we've heard, some Zoom fatigue and some other challenges. So what's the appropriate way of using these technologies moving forward, really to impact positively the health and well-being of the graduate students? Again, I'll throw this out to whoever wants to take it first. Barb, I see, I see a hand up.
Yeah, I'll just jump in real quickly that I think that's an excellent observation. And not only is it the benefits of, you know, improving access by, you know, a number of populations to even participating in a student's final seminar, or, you know, final exam, you know, things like that. What we're seeing is that many more students now have access and are participating actively in all sorts of professional and personal development kinds of activities that we do. So writing workshops, for example, we've seen a 400% increase in participation in writing workshops, in career development workshops, career exploration, grant writing, workshops about, how to negotiate a successful mentoring relationship with your advisor, because so many more people now are not constrained by being in the same location. They're also able to, to look at these things that are recorded, and then posted, even after the fact. So the real-time participation has increased 400% in some cases, and that doesn't even include then the asynchronous kind of benefits that exist. So I really do hope that continues after the pandemic. That said, I think we all recognize that there is a lot lost by not having that in-person contact. But as we go forward, developing an appropriate mix of in-person and continuing these online activities that give more access to people across the world who can participate in these professional and personal development activities, I think is really critical.
Barb, both you and Jim have mentioned a couple of times mentoring in light of COVID and its effective mentoring's need for student health and well-being. One of the findings that we saw in the survey was that graduate deans really felt that while mentoring was continuing and people were making the best of the Zoom or whatever technology they may be using environment, that they felt that it really was not an adequate replacement for the type of in-person mentoring that had been occurring before. And so I'm just wondering if there are any lessons learned or best practices that you can share with our colleagues here on maybe how to effectively mentor in this area where there's still physical restrictions as far as all being in the same place together.
So I think I mentioned that we had a Faculty Senate task force on graduate student mentoring that actually did come up with a list of best practices, and I don't have that in front of me. Some of it was relatively simple, as I recall, such as make sure you have regular meetings. Don't take this as an excuse to stop having weekly meetings if that's what you do. Don't stop having group meetings. If you do lab group meetings, you can do that online as well. But then I think there are some things that may work better in an online mentoring format when people get used to it. And I'm thinking particularly about the ability to put up a shared document on screen, look at it, even work on it together, and things like that, which could obviously take place face-to-face in some fashion, but which the technology may actually facilitate getting more deeply into that kind of collaborative work during a mentoring session. So I think this is something we still have a lot to learn about. And as Barb said, there's a need for a mix of the approaches that are used, but we should certainly be looking very seriously about what some of the advantages of online mentoring sessions might be.
And one thing that we're doing as well, Annie, is partnering more actively with the faculty development office at Cornell, so that we're offering joint workshops that are for faculty, but on mentoring strategies. One, from a faculty development office perspective, it assists faculty in being better skilled and better adept at meeting promotion and tenure criteria. From our perspective, it makes them more skilled, like as Jim is suggesting, with having best practices that will benefit our graduate students. So that kind of partnership existed, pre-pandemic, but there's much more attention to that now. And I know that will continue even after the pandemic is behind us someday.
The one thing that I was going to add is the benefit of the online for us. And I think it's probably the case for us all. I mean, it has these really complicated privacy issues related to them, but I've seen more of my graduate students' reality than I never would have seen. Like, one of my graduate students who just had triplets, I know the triplets. And so she also sees into my space, and I'm like, pay no attention to the dirty dishes behind me. She's like, oh my God, you don't wash dishes. So there's this humanizing kind of reality. Yes, I wash dishes at the end of the day, but there's this humanizing thing that I think creates a very different mentorship relationship with people that you have very formal professional relationships. For someone, for students who are being mentored by people who draw this very clear line, and that's the case with, actually with most of our faculty and our student relationships, it's very clear demarcation, which I think is just culturally the case. We'll give you a hug, but you're not coming to my house. So they're like, they're very, and so even the culture difference shift between when I was at LSU and when I was at Howard, like, no, I don't do that. But now with the pandemic moment, it's like we're all in this together. So there is the benefit of helping students to understand, graduate students, like how to build compassion, how to be graceful, and how to find ways to negotiate spaces in ways that we're doing at the same time.
Well, I like all of the emphasis on, kind of making the best of the situation and looking at the silver lining. And I think that there are a lot of silver linings with some of this online mentoring, certainly sharing documents, being able to more frequently see one another. And Dana, if that graduate student who just had triplets can offer some sort of stress management class, like maybe that's an innovation that can come from this. I cannot imagine triplets in a pandemic as a graduate student.
Writing a dissertation and revising like she's a machine. I really don't understand how she's doing it.
She should teach a class. She should teach a stress management class.
Yes.
We have another question from the audience. Part of our high-level overview leading into this session was on how different student groups have been differentially impacted, specifically international students, graduate students with families. Another question came from the audience on, have students from different STEM programs been impacted differently during the pandemic? If so, what areas have been able to adapt and pivot more easily? And can we learn anything from those areas?
Yes, from the STEM disciplines have differed, and just logically, and I think many of us have experienced this, that the STEM disciplines that that can where the scholarship can be done remotely have had the least impact, in the sense that if they can pivot from lab-based primary data analysis to computational analysis, and they have the internet connections available to do high-powered computation, they can do that. The lab-based work has changed and has put different time pressures on students particularly. So, labs that used to be, 6 or 10 people working in a lab at a time are now maybe 2 people in a lab at a time because of social distancing. But it's not being in the lab from, 7 a.m. to 7 p.m. It's being in the lab for, maybe 4-hour shifts. And then the next set of 2 people comes into the lab, and, then that first set goes home and, does whatever writing or analysis that they can remotely. So, so I don't know that I could identify a STEM discipline that has been unaffected, but certainly the impacts that students are experiencing are different, by discipline, and of course, whatever their remote situation is at home with technology and family pressures and all of those. Certainly the STEM disciplines, as has been mentioned earlier, STEM disciplines that include field work. That's not necessarily international field work, that could be domestic field work. If it's field work from, kind of a, ethnographic perspective where you had to do in-person interviews or observations, that's shut down, because of social distancing and all. If it's ecological field research, that may still be shut down because of travel restrictions between states. I live in New York State, and from, I don't know, 35 states or so, if you come to New York State, you have to quarantine for 4 days. So, so those kinds of things, you may not have an extra 14 days just to sit around, in your research schedule before you can actually start doing the research. So, there are those kinds of complications that I think for every discipline has made it challenging, but that makes it even more challenging from a graduate school perspective to advise students about how to handle, because each of those challenges are somewhat different depending on the discipline and the circumstances.
Thank you, Barb. I think our time is up, but I just want to first thank the panelists, Barb, Dana, Jim. This was a really great discussion, and we covered a lot of areas. I hope that our attendees found it useful. There's also been some really rich discussion going on in the chat. I don't know if you've noticed, but we'll certainly save that, and this will all be incorporated into our final analysis that'll make it into the final working paper. So thank you all very much. I appreciate your time and your attention to this matter. It's certainly an important one for our graduate students in this time. So with this, I'm gonna turn it back to Deborah Stewart to provide some final closing thoughts on our first day of the convening.
Let me begin by just saying thanks to all of you for a phenomenally rich afternoon. Thank you to the panelists. Thank you to my colleagues from NORC. Thank you to the questioners. You've had a phenomenally challenging 6-month period, and you've reported kind of Herculean efforts in the weeks and months that have occurred since this all began, depending upon whether you're the people on the clinical side at USCF and knew in January that we needed to act, or like most of us in March, universities were beginning to try to respond. You know, I was reminded today as I listened to these phenomenal presentations of an article that Freeman Rabowski published yesterday, I think it was, in Inside Higher Ed. He's this great guy who's president of UMBC. Probably many of you know him. And he published it with 2 of his faculty members. And the basic message, he was talking about the pandemic and how they've coped at UMBC, but the basic message was, and these were his words, keeping hope alive doesn't just happen. It requires deliberate effort, and it requires deep commitment. The goal of today overall was to sort of put context around the numbers that we have. But actually what we heard, I think, while it did put context, we heard a story of deliberate effort, and we heard a story of deep commitment. What I'd like to do is, you know, it always falls to me to try to, after 4 hours of very rich discussion, then it falls to me to try to sum this up in 10 minutes. So it's going to fail on that front, let me just warn you. But let me just highlight a couple of messages that I heard that bridge across several of the panels. Because the question we're asking ourselves is, what is it that we as a research team trying to advance knowledge in this area need to do next? There were a host of items that led me to think that we have much more analysis to dig into in our own data. For example, in at least 2 of the panels today, there was extensive discussion of communication. There was a discussion of the relationship between communication and mentoring. There was a discussion of communication and the structure that universities used to respond to COVID-19. Well, we actually have a lot of data that would allow us to look at the intersection of communication, strategy for organizing response to COVID-19, and mentoring practices. And so that, for example, is one of the things that will be very much on our to-do list with the data that we already have. There's a second category of thoughts that I've had about new data that we really can't eke out from the survey that we have, and we need to begin to think about how to pursue this going forward. We clearly need to learn more about the intersection of the very powerful and important movement in America today for racial justice and social equality, and the way in which COVID has impacted particular populations among our graduate students. We know a little bit from our survey about how graduate schools have attempted to reach out, but we didn't design the survey to really get at this in detail. And so that's more information that needs to be uncovered. We also need to understand much more in a fine-grained way about how COVID is impacting progress through graduate school and beyond, and how that varies by field, by domestic situation, by racial and ethnic identity, perhaps by socioeconomic status, and maybe by, over all of that, the specific ways in which the graduate school attempted to understand and to listen to and to respond to graduate student needs in these difficult days. And then the third category of activities that I think we now need to undertake, having listened to everything today, is to be much more proactive in reaching out to create partnerships across the set of people who are doing research in this area in the country. And obviously, when Craig presented this morning at the beginning of the afternoon, and we wanted Craig to be on that introductory panel so that it could be clear that we were developing a body of research on student perspectives. But I mean, it's startling to think that 31% of the students in this study of 10 universities reported post-traumatic stress disorder, that 25% of the STEM students exhibit concern about future careers, and that 25% of the students report a real sense of neglect. Now, the interesting thing is, our data also indicate that this is a real concern and was identified on the part of by our graduate schools and our graduate deans as a top issue of concern. So it's not that we didn't know this, but knowing it in this kind of detail, we need to figure out how to bring these kinds of projects together. Now, each of these examples that I've given of further analysis we can do, new data that need to be collected, partnerships that we need to build, illustrate how we will continue to add context in an effort to get the story right. But you've really gotten us started on the way today, and for that we thank you, and thank you again to the panelists, and thank you again to the many members of the broader audience who submitted questions. Tomorrow we turn from this rich discussion of what has been and what is now to focus on the future and ask ourselves, what is it that we have learned in what we're now doing and trying to do that can shape and reshape graduate education in STEM fields going forward? Now, when I even say going forward, I myself hesitate, because sometimes it's even hard to imagine a day when we won't have to don masks when we leave our houses, or ensure that there's appropriate social distance when we meet with our students or our colleagues or our research team, when Zoom won't have to be our only mode of communication. But that day will come, and the question is, will we be ready for it? The answer lies in how well we can harvest what we have learned from what we have done already and what we will continue to do in order to make a better day tomorrow for our students, and more likely sustainability for our graduate programs. I very much look forward to seeing all of you tomorrow at 1 p.m. Eastern Time. I apologize for the Zoom exhaustion you must be feeling at this point in the day. I encourage you to go open a glass of wine or pour a glass of orange juice or have a soda or whatever it is that you do to relax. And please join us tomorrow again at 1 p.m. Eastern for an opportunity to really explore the innovative side of our COVID-19 responses. Thank you for being here.